Hello everyone, and thank you for joining us today for the virtual launch of MazikCare from Mazik Global. MazikCare is an EMR EHR solution built on Microsoft Dynamics AX 2012 and designed under CCHIT and HL7 guidelines. MazikCare is a solution that encompasses both the provider and the patient to help achieve goals, from better care to more effective financial practices. With deep expertise in enterprise resource planning and the health sector, Mazik is best positioned to address the demands of healthcare IT, getting the right information in front of the right people in the right way at the right time. My name is Lane Koreska from Mazik Global, and today I'm going to walk you through the functionality of MazikCare so that in the short time we have today, you can get a sense of how MazikCare helps healthcare organizations meet all patient management, collaborative care, billing, accounting, resource planning, and system integration needs with a global enterprise resource planning solution customized for the demands of organizations within the healthcare industry. MazikCare is an EMR with functionality specifically designed for hospitals and clinics and long-term care facilities, functionality designed to connect and strengthen all arms of a healthcare organization. I'm going to demonstrate that functionality today by taking you through a typical day in the life of an organization using MazikCare. So what we're looking at right now is the role center. MazikCare is a role-based solution, so it will actually affect the capacity and functionality that a user has depending on what their role is. Right now we're looking at this from the perspective of a physician, Dr. Phillips Brown. So here we can see all of his appointments for the day, we can see what's scheduled by the week, month, and we can also see a timeline as well. We can also see any reports or health news that the doctor is going to subscribe to. So to show you the way the patient intake process works, we're going to be jumping around from role to role. We're going to start not with the doctor, but we're actually going to start with the receptionist, who's going to schedule patient appointments for the day. So we'll jump into MazikCare Ambulatory, and we're going to select Visit Appointments because this is really what her area is going to be primarily concerned with. So we'll select the physician and the clinic that she's working with for the day, and this will show us the ledger. Now the ledger is really key because anybody who's working in this clinic needs to be able to see who's where in the process. To answer this, we have a color-coded system that allows nurses and doctors and receptionists to see exactly where a patient is at any given time in the patient intake process. So here you see we have a couple of different examples, one purple, one yellow, signifying that one patient is checked in, one patient is checked out. And so we'll get into this a little bit more, but just really quickly, that's just one of these great little touches that MazikCare has with it that really lends itself to being a very intuitive and usable system. So let's say that the receptionist is working and she gets a call from a patient who wants to schedule an appointment for today for 11 a.m. So all she has to do is select 11 a.m. and then go to Visit Appointments, and she'll select our patient for the day. Now the person calling is Mr. Steve A. Ball, so we'll go ahead and select him. And here the receptionist can see his MRN number, his gender and age and address and contact information all at a quick glance. So she knows that that's the patient that we want to work with today, so she will go ahead and select him. For schedule type, this is a new appointment, so she'll go ahead and mark that. And under notes, she'll mark the reason for the visit, which is that the patient is complaining of chest pain. So we'll go ahead and mark that, and then we'll very simply schedule the appointment. So you can see that it's open, it's not color-coded in any way. That's because the patient hasn't yet arrived. Let's say that 11 o'clock does go ahead and roll around, and we can check the patient in. So when the patient arrives, we'll just go ahead and mark that, and then we'll check in Mr. Steve A. Ball. Now you can see that his color has gone to yellow, signifying that he's checked in, but he's not yet in the examination room. So when the nurse is looking at this ledger, that's her key to take over. So we'll go ahead and jump. So the nurse is logged in, and she sees the common screen. So what she's going to do is she's going to select Visit Appointments to take a look at her ledger for the day. She'll select the physician and the clinic, and then she'll just see who's scheduled for the day. Right now she sees our patient, Steve Ball. He's checked in, but he's not yet in the examination room. So that's the nurse's cue to go ahead and move him into the examination room by beginning an encounter. So creating a new encounter is very simple. All she has to do is select the reason for the visit, which is chest pain. And if the nurse learns anything additional about the visit, she can go ahead and enter this here. So we'll say the patient is suffering minor chest pain on the right-hand side. We'll go ahead and create the encounter. And you can see that the color changed, and this brings us into the encounter screen. Now the encounter screen is really critical for the nurse and for the doctor because this is where we'll be really seeing the heart of the patient process. So here we have our vital signs and our allergies and our health maintenance reminders. For vital signs, the nurse is going to record all of the vital signs for the patient. So for diastolic blood pressure, we'll say 95. For pulse rate, we will say 80. Systolic blood pressure, we'll say 145. And for temperature, our patient has a little bit of a fever today, we'll say 101. Also, if the nurse wanted to leave any comments here, she could. But now that the vital signs are recorded, we're ready to move on to allergies. For allergies, we have 2 listed, but just so that we can show you how this works, let's go ahead and mark aspirin as resolved so we can get rid of it. And we'll say that caffeine is the only listed allergen we have for the patient. So the nurse says, okay, Mr. Ball, I see that caffeine is you're allergic to caffeine. Is there any new allergy that you have? And he'll say, yes, I do have a new allergy. I'm now allergic to aspirin. So we'll go ahead and mark that. And the reaction is allergic rhinitis, so we'll go ahead and select that and close it, and we have the new allergen listed. For health maintenance reminders here, this is your opportunity. If you want to have any pre-scheduled reminders for the patient or for the doctor, this is your opportunity to fill in these values. We have diabetes screening listed. There are any number of reasons why you might want to enter a value for a health maintenance reminder. Many times we'll have a patient is traveling overseas for a given amount of time, and he needs to begin a regimen of inoculations or vaccinations. This is where you could enter that information, and you could have automatic maintenance reminders sent to the patient and the doctor automatically via email. We're not going to enter anything new for this one, so we'll go ahead and leave this. And that is the role of the nurse. The nurse has now completed her part in the patient intake process, and now it's time for the doctor to take over. So once again, we'll go ahead and jump out of the nurse role, and now we'll take a look at it from the doctor's perspective. Now, the doctor using MazikCare has an opportunity to review all of this information before he even enters the room. So if he just goes to Patients, he can take a look at the profile for Steve Ball. So he'll go ahead and select him. And this is the patient's profile screen. So this is really great because the doctor is able to move all of these data cubes around according to his priority or whatever is particularly relevant for today. These are all the different options that the doctor has for values that he wants to look at before he even enters the examination room. He can take a look at the patient's vital signs in a graph. He can see active allergies, active medications, any healthcare reminders, social history, active problems, family history, etc. And again, this is just a way where he can move this information around and take a look at it in a different format before he even enters the room. So he's reviewed all of this information. Now he's ready to go ahead and bring up the last encounter for Steve Ball so that he can jump into the appointment with him right now. All right, so now we're in the encounter screen with Steve. So we'll go ahead and we'll review all of these vital signs. We'll take a look at the values that the nurse entered. And that's reviewed, so now we'll go ahead and take a look at his allergies, aspirin and caffeine. This we need to mark as reviewed because this will inform any decision that we make in regards to prescribing medication. So the doctor will go ahead and mark this as reviewed. And we can take a look at health maintenance reminders. If there were anything down here that were relevant, we could use this. And now that this is all reviewed, we're ready to jump into the clinical documentation. The doctor's ready to begin his SO notes. So to do this, very simply, all he has to do is select templates. And he's going to select chest pain because that's the reason for the visit. He could have this list pre-populated with whatever templates are particularly relevant to him. This is all entirely customizable. So we'll go ahead and select chest pain just for today. You can also select more than one template. Right now we're just working on chest pain. So we'll go ahead and select symptoms. Now what's great about this is that all of these preloaded questions are customizable. If there are questions that the doctor wants to ask or questions that he doesn't want to ask, he can load or remove them as necessary. But he also doesn't need to mark an answer for questions that he doesn't ask. He only needs to mark answers for questions that he does ask. So let's say for his findings, yes, the patient has a fever. Yes, there are cardiovascular symptoms. Yes, there's chest pain and discomfort. But we'll say no for everything else. Instead of having to click no for each single thing, we can just very simply auto-negate, and then that'll fill it out for us. We can move down here to past medical history. And let's say, yes, there was a reported high level of cholesterol. Yes, there is a reported history of a heart murmur. And yes, there is a history of a chest trauma. Everything else is no, so we'll go ahead and auto-negate that and move into physical findings. The doctor finds yes to some rib point tenderness, and no to everything else. So he'll go ahead and auto-negate. Social history, yes, the patient does drink, so we'll go ahead and select yes. And that is it for the SO notes. Now the doctor is ready to, he can go ahead and review these and take a look. He goes through this with the patient and says, okay, is this all accurate? And the patient says, yes, but I would mention that with my fever, it's brand new. This just started this morning. It's not something that I've had ongoing. So the patient will go ahead, or the doctor will go ahead and mark as new occurrence for the fever. And he can go ahead and save that. And that's one of the great things about MazikCare is that rather than designing two different systems for two different types of doctors, we've taken into account that some doctors want to be able to write their own notes, others want to be able to use an automatic system like this. This accommodates both types of doctors because if you want to use an automatic system, you can, but if you want to make any adjustments on the fly, this also allows that. All right, so now we're done with the SO notes, so we're ready to jump into the assessment and plan. So we'll go ahead and click on this. And for diagnosis, we're going to have to begin a new diagnosis, so we'll select new. And this is really great because we have SNOMED CT integration, which has, I think, 4.6 million, something like that, medical terminology definitions. So rather than having to, if you're a doctor who wants to use those or if you're a doctor who doesn't, you have the option to use either. So we'll go ahead and select chest, and this will give us all of the relevant codes that fall underneath that template. So let's go ahead and we'll just select contusion of chest for our diagnosis. And we can also mark if this is acute or if this is chronic. Let's say that it's acute for today, and we'll go ahead and close it. And we have a new diagnosis. Now we're ready to jump into medication order, so we'll go ahead and start a new medication. The medication that we're going to select today is Bayer. So for our dispense quality, we'll say 1 strip and 2 tablets, or 1 tablet. Orally, twice a day. If we wanted to leave any notes to a patient, we could. We'll mark him yes for refills. We also have the per rising need option. We see ourselves here as the prescriber. And also beneath here we have our pharmacy. If the patient has a pharmacy that he wants to have preloaded with us, we can actually send the prescription immediately to the pharmacy via e-prescription so that the patient doesn't actually have to carry his prescription with him. So now we've got the medication completed and we can jump into clinical procedures. If we had any, we don't. We want to go into our lab orders. We do want to order some tests, so we'll go ahead and select new. For our test code, we want to order a full blood count, so we'll go ahead and select FBC and close that. Now we can jump into radiology orders. We do want to order a chest x-ray, so we'll go ahead and find that in our service catalog and select that and close. There are no other therapies that we want to use, so now we've gone through the SOAP notes and we're ready to move into disposition. So for follow-up, we'll go ahead and select as needed. If there were any comments that we wanted to leave or any consultation notes, we could do that here. There's not. So now we're ready to actually complete the encounter, but before we do, let's take one last look at it in a different style of view. We can actually see this in a narration mode, and what that does is that actually transcribes the entire encounter that we just completed into this itemization that you see before you. So this has all of our notes, all the notes that we took for fever, all of the complaints, past medical history, etc. You also see the tables of information. This up here that's highlighted in blue, this is highlighted because it's still adjustable. We haven't signed the encounter yet. If we wanted to make any changes here, we could. This would be our opportunity to do so. So let's say that our doctor reviews this information with the patient. There's nothing that he wants to change, so he's ready to sign the encounter. So we'll go ahead and do so. It's going to ask us if we want to. We say yes. Now that the encounter is complete, we're ready to check the patient out. So what we'll try to do here is we'll try and check the patient out, but it's going to tell us that there's one step that's not been completed yet. So let's go ahead and try it and see what it says. Only billed cases can be checked out. The patient needs to be billed. That's fine. We'll go ahead and select OK. And we'll leave the ledger and we will go to MazikCare Billing and Claims. So we'll go ahead and select this. We'll select active patients, and this will give us a list of all of our patients currently in flux. We'll select Steve, and we'll go ahead and begin generating an invoice for him. We'll select cases, and we'll select his active case, which is the current encounter, and we'll go ahead and generate the invoice. Here it gives us the option we can do a copay invoice or a case invoice depending on what's dictated by his insurance. In this example, we'll use case invoice, and it will give us a note saying that the bill is successfully generated, so we'll go ahead and close that. And here we can go ahead and view the bill. So this will give you an itemization of everything that's been completed for the day. It'll give us the account summary, it'll give us the patient services provided, the nursing service, the physician fee, and the associated costs. It will also include a little bit of his insurance information down here so we can review this, and that's what the patient's bill will look like. So we'll go ahead and close this. Now that the patient has been billed, we can go back to the ledger and we can attempt to check him out once more. So we'll go ahead and select him and select check out. We know the patient is checked out. The color has changed from green to purple. So there you have a complete and successful patient encounter using MazikCare. So there you've seen the role center. You've also seen a little bit of the functionality of MazikCare using this kind of day-in-the-life scenario that we've envisioned. So I'm going to finish just by simply saying that this is not the end. MazikCare is a deep solution with enormous functionality and capability, and there really isn't a satisfactory way to demonstrate all of that in 20 or 30 minutes. You know, many companies might take a product that works and slap a new name on it and say that it's a new vertical. Well, MazikCare is not that product, and Mazik Global, we're proud to say, is not that company. This solution was under development for years in close collaboration with the healthcare industry for whom it was built. This was never an afterthought. If you're in healthcare, if you're a hospital, a clinic, or a long-term care facility, then this is a solution that was crafted specifically for you. So please, to find out more about this product or to get more penetrating insight into how MazikCare can enable your organization to meet and surpass your goals, please reach out to us. My contact information is on the screen, lane.kareska@mazikglobal.com. You can also follow us on Twitter, Facebook, and LinkedIn. And of course, you can always connect with us on our website, MazikGlobal.com. So thank you all very much for being here today and helping us launch MazikCare. We're excited to put this solution to work for you. Thanks again and have a great day.